My name is Mary Ellen Ladd. I have an 8-year-old son named Peter who has cerebral palsy and a seizure disorder. When Peter was born 8 years ago, there were complications during the delivery, and as a result, he had brain damage. We believe there were warning signs during the delivery that were ignored. He can't walk, he can't talk, he can't eat. He can't sit without assistance. He requires lots of medical equipment, a stander, a walker, a wheelchair, bath chair, toilet chair. He requires a special feeding tube because he can't eat, and because of that he needs to have a special formula and some medical equipment for his feeding. Well, it all sort of unfolded because we knew when he was born that there were problems, and I mean immediately in the delivery room we knew that there was a problem, and they thought he would be okay. And then a couple of days later, we were still in the hospital, and the doctors felt that he was sort of unresponsive, and they did an MRI and realized that he had brain damage, and we didn't really know what that was going to mean. You know, okay, he has brain damage, but they couldn't say exactly what that was going to look like. So it was really just waiting, and as he grew and developed or didn't develop appropriately, that we could see what we were going to be dealing with. It probably wasn't until he was 3 or 4 months old that we contacted a lawyer, because we were concerned that if Peter's injury was caused by medical negligence, which we believed that it was, he should be compensated for it. And we definitely know now that the expense of having a child with cerebral palsy can be pretty big. I mentioned all the medical equipment. It's all extremely expensive equipment. And our regular insurance doesn't cover much of that equipment. At the time that we filed the lawsuit, there was a movement to cap non-economic damages for medical malpractice. And that was really upsetting to us because we were in the middle of having this legal process for Peter, and it just seemed so unfair to arbitrarily just pick an amount of money that would be adequate. And we didn't even know at the time what amount would be adequate to support Peter for his life. Cerebral palsy is not something that will go away. There's no cure. He requires all kinds of therapy. And that's just to manage his situation and to help him be as strong as he can be, but it will not get rid of the CP. So it's a lifelong issue that we're going to be dealing with. The feeding issue will likely be a lifelong issue as well. He has special medications he needs to take, probably lifelong. So we were really looking long term at how we were going to support him and keep him at home as long as we possibly could. And so it was very upsetting when you're hearing people say that these lawsuits are frivolous and that Peter's frivolous. Peter's not frivolous. He's the cutest 8-year-old kid. And you'll see his pictures and you'll know. We were really pleased to hear that the Connecticut Center for Patient Safety was getting involved, and that they were advocating for people like Peter who couldn't speak for themselves, and really gave him a voice, made a difference.